My name is Shelley Fritz, and I've been living with rheumatoid arthritis for a little over 12 years. My journey has always been about finding what will work for me, better ways to manage my symptoms of RA. I'm curious about the potential benefits of mindfulness exercises in alleviating discomfort and improving overall well-being. My experiences using mindfulness exercises have brought peace and relief from the challenges of living with RA. I'm excited to explore this approach with Dr. Laurie Ferguson. Dr. Ferguson is a clinical psychologist and director of patient well-being at the Global Healthy Living Foundation. Her area of research focuses on developing attitudes and behaviors that can help people living with chronic pain better manage the challenges they encounter while living with a chronic condition. Hi, Dr. Ferguson. Welcome.
Thanks, Shelley. Good to be here.
It's nice to talk with you today. We both read a study about mindfulness entitled Mindfulness-Based Stress Reduction with Individuals Who Have Rheumatoid Arthritis, Evaluating Depression and Anxiety as Mediators Change in Disease Activity. We'll be incorporating that into our discussion today. So I'd like to start off with the first question. Can you explain what mindfulness is and how it can benefit people living with inflammatory arthritis?
So mindfulness, it's important to sort of think of it differently than just people often think it's meditation. But mindfulness is actually a larger understanding, and it's being in the present moment. It's a way to help your mind, your nervous system, your body sort of let go of the way our mind chatter can take us in various ways and come into the present moment and experience that moment. It helps in many ways because, again, it is a way of focusing on the here and now rather than sort of, again, going off into the what ifs or maybes. And it helps a person really be present. Research has shown that it has both psychological and physical benefits.
So what are your initial thoughts about this study and how it might be useful to patients?
Well, I find the study very encouraging because it's getting some hard quantitative data that indicates that mindfulness practices, when used deliberately and over time, can help reduce the symptoms of depression, and that also has kind of a downstream effect on the actual symptoms of RA. So I think it's very encouraging.
Great. Yeah, I've never really spoken to my doctor very much about mindfulness, so reading the study kind of made me wonder how it could be incorporated into, say, shared decision-making conversation with healthcare providers.
So I think it would be something that you might bring up about whether or not it would be helpful in terms of managing your own symptoms, having your healthcare provider sort of look at the holistic picture of what the treatment plan is and see if some of these tools and practices would be useful.
So how can mindfulness be used to manage the emotional impact that comes along with a chronic condition?
So that's one of the things that this article and this research makes very clear is that mindfulness practices, when they are used consistently, help relieve the symptoms of depression. And depression, as you know, 2 to 3 more times diagnosed in people with rheumatoid arthritis than the general population. So it's a significant sort of adjacent thing that happens. And so finding ways to manage that, again, there's an interaction between depressive symptoms, RA, the experience of RA symptoms, and mindfulness. That interaction tends to be very positive when mindfulness is used.